Hi, my name is Michael Seidman. I'm a medical doctor. I received my training at the University of Michigan Hospitals in Ann Arbor. I then went on to do a residency in otolaryngology head and neck surgery, which is the fancy name for ear, nose, and throat surgery. I did that at Henry Ford Hospital in Detroit. And then I did a fellowship in hearing and balance problems to become a otologist, neuro-otologist. And I did that at the Ear Research Foundation in Sarasota, Florida. Today I'd like to talk to you a bit about tinnitus, or ringing in the ear. As a physician, there is nothing more discouraging to say to someone that, I'm sorry, there's nothing you can do about your tinnitus, or learn to live with it. These statements, in my opinion, are not only inaccurate, they are insensitive and uncompassionate, and promote a feeling of helplessness and despair. I have to temper that and say that while a cure for tinnitus may not yet be available, as healthcare professionals, in my opinion, we have both moral and ethical obligations to provide whatever help is possible. There are two types of tinnitus. One is called subjective tinnitus, and the other is called objective tinnitus. Subjective tinnitus is the medical term for noises perceived to be coming from the ears or the head without any kind of external sound source. So there's no sound present, but the person still hears a sound inside the ear. Many people describe this as being either a ring or a buzz, a cricket type of a sound, air escaping from a tire, birds chirping, the list goes on and on. Some people will experience the ringing in only one ear, some others experience it in both ears, and other people say it's not in my ears, it's somewhere in my head. The sound can be continuous in nature all the time. It can come and go. It can be low pitched like or high pitched like ee. It can also be pulsatile, a sound like this, whoosh, 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 sort of matching your heartbeat. So I started to mention tinnitus is classically described as either subjective or objective. I've already briefly mentioned subjective, but for objective tinnitus, that's a sound that actually I can hear as a listener. It's very rare. So that's a sound that's heard by both the patient and the examiner. Subjective tinnitus is only heard by the patient. Of the two of these types, subjective and objective, subjective tinnitus is more common. Almost everybody in the world, at one time or another, has experienced ringing in the ear, and usually for most people, thankfully, it's transient, meaning it comes and it goes away. For many other people, such as yourself, it can be a much more difficult problem. And it is important for me to know, or important for you to know, that you're not alone. Tinnitus affects approximately 30 to 40 million Americans, so that's just in the United States alone. Of these 40 million Americans, about 12 million Americans seek a professional opinion regarding this particular symptom. And about 1 or 2 million people are so severely affected that they are bothered by this and they don't function very well. The causes of tinnitus may vary. However, the most common causes are inner ear disorders that can result in hearing loss, for example. One of the most common causes of hearing loss is the normal aging process, which can begin as early as 30 to 40 years of age and can extend on from that point. Other common causes of hearing loss include exposure to loud sound, much more common now, especially in our young kids who are listening to boom boxes and other noisy types of instruments. Blow drying your hair, for example, pushing a lawnmower, all those types of things are very loud noises that one has to be careful with. Viral infections may also be a cause. Certain medications, and the PDR lists more than 70 or 80 medications that can cause ringing. And Meniere's disease is a disease, just to mention one of those, just to name a few. You can also have benign growths on the hearing nerve that can be a cause of tinnitus, but this is extremely rare. It is usually only in one ear, and most people that I see it in one ear almost never have it. I'd like to refer to the diagram for a moment, if we can go ahead and talk about some of the problems inside the inner ear. This is the diagram of the ear, and again you can see that there are three main parts. This is the external ear, where wax occurs and where people get swimmer's ear infections. The middle ear starts on the inside surface of the eardrum, which is here, and it consists of the malleus, the incus, and the stapes, which are the three smallest bones in your body, also called the hammer, the anvil, and the stirrup. The middle ear is connected to the back of the nose via the eustachian tube. There's actually an entity called palatal myoclonus, which causes a clicking or a popping of the eustachian tube and possibly a tensing of these muscles inside here and can cause some clicking or popping in some people's ears. The inner ear starts on the inside surface of this third bone of hearing, and it consists of the cochlea, which is the snail shell-shaped organ responsible for hearing. and it also consists of the semicircular canals, which is responsible for balance. And then here are the hearing and balance nerve, and also the nerve that makes your face move, all run inside what we call the internal auditory canal. And I was talking about little benign growths that can occur here. It's an unusual cause of tinnitus, but it can certainly cause it, and it's something to be considered. Other areas, when we were talking about aging, if you look at this part of the diagram here, this is actually a cross-section of the cochlea. And inside the small center part are tiny hair cells, which you can see if you look farther down on my diagram. Hopefully you can see this down here. But in here there are these tiny little hair cells called inner and outer hair cells. And these hair cells, with aging and with specific medications, can become damaged over time. And it is thought that every single hair cell, and there are literally thousands of these, when one gets damaged, it sets off an abnormal signal which may cause the ringing in the ear. So again, one of the most common causes of ringing in the ear is a high-frequency hearing loss that is very typical of aging or noise exposure. I was mentioning the growths that can occur on the hearing nerve earlier. These growths occur in about 3 to 5 out of 100,000 persons. There are many other causes of tinnitus. These may include things such as high blood pressure, for example, hardening of the arteries, high cholesterol and fat substances in your body like lipids. Other types of problems that can occur are things like nutritional deficiencies, and these are very difficult to prove, but things such as zinc or iron or B12 deficiencies may cause ringing. Again, hard to prove and something that we don't often see but can occur. Diabetes may cause this. There was a study looking at temporomandibular joint. The jaw joint sits right near the ear, and problems related to that may cause some ringing. Hard to prove again. Seizure disorders may also be a cause of ringing, or migraine equivalents. We recently wrote a book chapter back in 1990. We recently wrote a book chapter which listed more than 55 causes of tinnitus. So there's quite a few things to be considered in that regard. Prior to your appointment with me, it is optimal that you have had a thorough general medical evaluation, which would include an evaluation by your internist or your family care doctor. And I want that to happen to rule out contributing medical conditions, some of the things that we've already mentioned. This may include a complete history and a physical examination where I hope that they pay particular attention to your heart and your lungs and neurological symptoms. That means like the brain. So we want them to listen to your neck vessels to be sure that there are no sounds suggestive of abnormal or reduced flow inside the vessels, which might suggest low flow to the inner ear and may contribute to the ringing. Routine blood sampling at some point in time would be probably a good thing to have done to rule out medical disorders that may lead to the tinnitus, such as the low blood counts, like anemia. And what that does is it causes the heart to work harder and to create vascular turbulence inside vessels near the ear, which can make a pulsatile sound, which is a form of ringing in the ear. There may be other tests indicated by your primary care doctor to rule out things such as thyroid disease or the high cholesterol and the high lipids that we have talked about. Once you have been seen by your primary care doctor, you'll oftentimes be referred to me. I evaluate my patients with tinnitus using a complete otolaryngologic history and examination. It is very important for you to tell me if there are any associated features with the onset of your tinnitus. For example, was it associated with an upper respiratory tract infection or an infection anywhere else in your body? Is it possibly related to any type of medication that you may be taking? Have you had any unusual headaches, nausea, throwing up, or any other symptoms, including weakness of half of the body, numbness, confusion, memory changes, all those sorts of things that may suggest a possible ring cause. Additionally, it is important for you to tell me of any significant noise trauma. For example, were you ever exposed to chronic noise such as working in a factory, an airport, or in the military? Do you listen to music loudly? Do you wear headsets to hear tapes? It's also important for me to understand the characteristics of the ringing in your ear. I need to know the location of the ringing. Is it coming from one, or is it coming from both ears? Or does it appear to be coming from somewhere inside the head? I want to know the quality of the tinnitus. Is it pulsatile? Is it high or low frequency? Is it continuous, or is it intermittent? I also need to know how intense is the noise. What is the severity of this noise? All of these questions are important in the understanding of the nature of your tinnitus and the degree to which it is affecting your lifestyle. It is also important to determine if you may be taking any medication or drugs that may damage your hearing or cause tinnitus. the physician's desk reference lists over 71 medications that can cause ringing. The most common being aspirin, for example. There are also many antibiotics, not most of the ones that you take from your doctor, but if you have a bad pneumonia, for example, that can cause it. But other medications like Motrin or Naproxen or Anaprox in high doses are known to cause tinnitus. This type of tinnitus is usually reversible once you stop the medication, but occasionally it's not. Other commonly used medications that may cause tinnitus include things like quinine, which are used for leg cramps, diuretics, which may be used for blood pressure, and the aminoglycoside antibiotics, such as gentamicin, for example. Your social history is also very important to me. For example, do you use tobacco or caffeine and alcohol? These three, for example, may be associated with an increase in the intensity and severity of the tinnitus. Other medications such as birth control pills or monosodium glutamate that is used in many Chinese food preparations or coloring agents, marijuana, those types of things may cause ringing as well, so it's important for me to know that. Genetic studies and hereditary information is also very important to me. Do you have any family history of hearing loss? Was there premature graying or family members that had different colored eyes, meaning one person with a blue eye and a brown eye? This could suggest a hereditary disorder called Waardenburg syndrome, for example, and that causes hearing loss and may cause some ringing. It's important to know if you have any significant balance problems, because often balance abnormalities may be associated with hereditary hearing loss. Tinnitus, or ringing, does not affect all people in the same way. It is important that you clearly relate to me how it is affecting you. For example, are you able to conduct your usual daily activities? Do you still go to work? Or do you have too much stress to go to work because of the ringing in the ear? Are you having difficulty performing your job well? Do you have sleep disturbances? Does it prevent you from falling asleep at night? Does it wake you up in the middle of the night? How is your family environment and your social situation? Are you under a great deal of stress, or do you find yourself becoming reclusive because you don't care to be social because of the severity of the noise? And lastly, have you ever had ideas of suicide? That's important. I've had some patients who have had suicide thoughts. Statistics suggest that 1 to 2 million patients with tinnitus are severely disabled. Many other people with tinnitus note that it is present and mildly annoying, and they just want to know why they have it. Following the history and the ear, nose, and throat examination, in many cases even before, you will probably have had a hearing test, as hearing loss, again, is the most common sign of inner ear disorders. Other tests may be ordered and may include an auditory brainstem response test, which measures the function of the hearing nerve and the hearing portions of the brain. This test does not hurt. It takes approximately about 1 hour of your time and requires the placement of small sticky electrodes on your head and a small device inside your ear. While this is a very good screening tool, it may miss small growths on the hearing nerve that we had talked about. I'd like to just refer to the diagram for just one more moment again, if possible. And on the hearing nerve again, there can be small growths. For these benign growths that are greater than 2 centimeters in size, this auditory brainstem response test is accurate in approximately 96% of the cases with these growths. But if that growth is smaller than 2 centimeters in size, it can miss up to about 22% of them. This type of test is a very good screening tool, and it's a very good screening tool to look for growth on the hearing nerve. I don't always use that test. Other tests may on occasion be ordered, including such tests as electronystagmography, which is used for balance. Electrocochleography may help, but I rarely order those for this type of problem. On occasion, I order a CAT scan or a magnetic resonance imaging of the head, which are tests to look inside the head to make sure the brain is okay. For simple ringing in the ear, we oftentimes do not order an MRI or a CAT scan. It is something that we may order. Many physicians and healthcare providers have told their patients that once they have ringing in their ears, there's nothing which can be done for it. They must learn to live with it. Although I don't have any magic pills or magic surgery that I can give to you or perform on you to miraculously make this ringing go away, I would definitely disagree with those types of comments. And I feel that there is certainly a great deal that can be done to potentially help. Since 1992, I have been actively involved as the medical director of the Tinnitus Center at Henry Ford Hospital. This is one of 5 tinnitus centers in the United States of America. and many patients have benefited from a group effort, if you will, evaluating tinnitus. Once the evaluation has shown that no dangerous problems are present, there are many treatment options which can be considered. If the tinnitus is mildly bothersome, simply turning on a radio, like FM static, for example, or a TV can provide background sound that may distract you from hearing the ringing. Hearing aids and masking devices, called tinnitus masking devices, may help to reduce the perceived annoyance of this ringing. These devices can be obtained through the Division of Audiology or most hearing aid dealers. Additionally, stress reduction and habituation therapy, where we teach you to sort of not pay attention to the noise, may also be of benefit in patients with tinnitus. From a dietary standpoint, it may be helpful to eliminate salt, caffeine, nicotine, and alcohol. We had already alluded to that earlier. From a medical standpoint, we have many options. I should say from a medicinal standpoint, we have many options. There have been some medications that have been evaluated in controlled studies. And this is a study, for example, where we take 100 patients with tinnitus who are divided into two groups. 50 are given a placebo, which is a fake pill, if you will, and 50 are given the real medication. Neither the doctor nor the patient knows what they are getting, and after a predetermined time, the code is broken. And what we've found is, unfortunately, some patients in the placebo group get better, but what we hope for is that more people in the treatment group get better. More than 75 medications have been tested on one level or another. Some of these medications include something like Xanax, which is very similar to Valium and can be sedating and can be addicting, but it's been shown to help in about 70 to 75% of the patients. Another medication is something called lidocaine. Lidocaine they can inject into your vein and it can reduce the ringing in about 50% of those patients. The problem is that lidocaine can also stop the heart. So clearly there are pros and cons to these medications. There are other medications based from a more holistic standpoint, but they have not been proven with the standard research testing. An example is niacin, or niacinamide. This is a vitamin. You buy it at the drugstore. It's believed to work by improving blood flow to the inner ear. One downside of it is it can cause a pins and needle, a burning sensation, or a flushing sensation, which is a very common reaction. I've had some people go to the hospital because they were so concerned about it. Another medication is actually a plant extract called ginkgo biloba. It is a 300-million-year-old plant extract, which has also been shown to improve blood flow. It's been touted to help people with balance problems, ringing in the ear, male pattern baldness, all those types of things. If you elect to try either niacin and ginkgo, they must be used for a minimum of 3 and preferably 4 months before you determine whether there was a beneficial effect or not. The niacin dosing is typically about 50 milligrams twice daily. If there is no improvement, I tell my patients that after about 2 weeks, you can increase by 50 milligrams every week to a total of 250 milligrams twice a day. If you get much higher than that, you can have problems with it, so I don't recommend much higher doses. Ginkgo biloba dosing is typically 40 to 60 milligrams, and some people have gone as high as 120 milligrams 3 times a day. There are potential side effects with all medications, and even vitamins or herbs can have potentially dangerous side effects. There have been reports of death associated with aspirin, for example, to put things in perspective. Niacin can potentially cause reduction in cholesterol, which is usually a good thing for most people. But levels that are very high can cause liver failure, for example. I've never had a patient have that, but it's something to think about. There's also been one report of bleeding in the head from a patient who was taking ginkgo biloba for more than 2 years. However, many people have been taking this medication for many more years without any of those side effects. Other medications which are frequently used include a medication called Elavil. Elavil is an antidepressant which has been found to be helpful in patients with tinnitus. Often the Elavil will improve your sleep habits, which serves to decrease the stress and improve one's tolerance for the ringing. Xanax is another commonly tried medication, as it has shown some promising benefits in the double-blinded, placebo-controlled studies that I alluded to earlier. I typically will reserve these types of medications for my severely affected patients, as the side effects can be more prominent, and these drugs are potentially habit-forming. Xanax is very similar to Valium, for example, so we have to be very careful with that. Many other medications have been tried in the treatment of tinnitus with very much mixed reports. There are also medications which can make ringing worse. Interestingly, Elavil, for example, is listed in the PDR as causing ringing, but it's also one that we use for ringing. So some medications which have been known to cause ringing are again also used in the treatment of that. Other accepted but less commonly used treatments include things like electrical stimulation of the cochlea, where we put a needle inside your ear and stimulate the cochlea. Biofeedback is something that can be used, and de-stressing techniques are very important, and I encourage you to do things that can help in that range. There have also been many non-traditional options for tinnitus sufferers, such as things like acupuncture. I've had patients tell me that they've gone there with some mixed results. Chiropractic manipulations, some patients have told me. Other herbal therapies and hypnosis, just to name a few. In summary, tinnitus is a very complex problem, usually caused by a common inner ear disorder, i.e. hearing loss, for example. Although we may not be able to miraculously make this noise go away, we do have many treatment options that may help. And I do want to hopefully have that opportunity to help you. I thank you for taking the time to watch this tape, and I'll be in to talk to you in a few minutes.